guys, Crystal Howell here with Empower Movement Physical Therapy. I wanted to go over some feet exercises for you. These are amazing for runners, and then especially as the weather is getting nicer, just in general, just to keep a healthy low back. So often with low back pain patients, especially if you've had it for a long time, you'll see this weakening in the feet, because what happens with a low back is, if my back hurts most of the time, I don't want to come into this extension moment. So when my foot's extended like this, you see how my foot bends up and then progresses through the next step. With low back pain, if my back hurts, I shorten my steps and don't take big steps. So then I'm also not using my ankle and some of the muscles in it as I should be. So these 3 exercises are awesome for this. So the first one is for a muscle called your posterior tibialis. This muscle goes behind the shin and then supports underneath the arch of the foot. When I've taken courses by this big guru on the foot, he said this is one of the most important muscles to strengthen, and we see this all the time in the clinic, especially as we age. Sometimes this arch of our foot starts dropping, so this helps support it. If it's weak though, you're always irritating it and the arch is going through too much motion. So how you would strengthen it, it seems very simple and like such an easy exercise, but your knee stays where it is. So sometimes I actually physically have patients hold their knee down because my kneecap should stay facing forward. Then you're gonna do something that looks like a windshield wiper. So my heel stays where it is, but I'm pulling my big toe in. Now the key is also that you're keeping your big toe down. Often what happens is you're gonna get this kind of motion up and in, because that's a way to compensate. So knee stays forward, heel stays where it is, and then this windshield wiper motion starts happening. So you should be able to do a bunch of these with keeping your actual big toe down on the surface. Another great one is called dorsiflexion. So I'm pulling my toes towards me, and I'm actually not the greatest at this either from running, but my leg stays straight, and then this band goes around and is at the top of my foot here, and then I'm pulling my toes towards me, letting them relax away, pulling my toes towards me, letting them relax away. You should see a ton more motion than I can display here. I just need to work on this one. But about 10 reps of each of those. The other good one that often gets neglected is coming up on both feet and then just down on one. Slowly and controlled down on one is the key. So I would rep it out on one side, coming down on this side. You don't want to see a lot of shaking in the heel. You want that heel to drop straight down. And then I would switch to the other side. So up on 2 and then down on 1. If you need to, you can hold on to a countertop just for a better balance. You should, actually the standard is that you could do 30 of those, even just on one leg by yourself. Now that's far off most people's norms, but it's something that we should be working on. So more reps is better with that one.